Hello, I would like to tell you a bit more about this PhD project on the isolation of bone sarcoma biomarkers using novel devices. Although tissue biopsy is the current golden standard for cancer diagnosis and evaluation, it still suffers from several limitations. It is time consuming, it is invasive, it carries the risk of complications, and sometimes it's not feasible because of the location of the tumor. An alternative to tissue-based methods is liquid biopsy, a minimally invasive approach which relies on obtaining tumor information from body fluids such as peripheral blood. Common biomarkers detected by liquid biopsy are circulating tumor cells, circulating tumor DNA, and extracellular vesicles. Now, for bone cancers such as osteosarcoma, Ewing sarcoma, and chondrosarcoma, liquid biopsies are not normally used, mainly due to the rarity of these cancer types. Also, the concentration of biomarkers in liquid biopsies of sarcomas is very low. Of these biomarkers, circulating tumor cells can provide information about the heterogeneity, metastasis, and response to treatments. But there are currently challenges associated with CTC enrichment due to their low concentration. EVs have shown promising results as biomarkers for osteosarcoma and Ewing sarcomas, but better isolation methods need to be developed. The aim of this project, therefore, is to develop a novel, selective, single-use system based on immunoaffinity membrane chromatography principle for the isolation of bone sarcoma biomarkers such as CTCs and EVs from whole blood. The membranes will be created using polyvinyl alcohol, which is a biocompatible, hemocompatible, and hydrophilic polymer and has already received FDA approval for medical devices. Electrospinning will be the method of choice for the fabrication of these membranes because it is a technology that is very effective, fast, and can produce supports with tunable properties and geometries. In this project, a novel alternative current needless electrospinning technique will be investigated because it produces membranes with much higher porosity compared to other types of electrospinning. And this is a huge advantage in the processing of large biological entities such as CTCs and EVs because it minimizes mechanical entrapment. The membranes will then be stacked in a filter holder and functionalized using standard protocols for the immobilization of immunoaffinity ligands. The efficiency and selectivity of absorption and subsequent desorption of the target biomolecules from these supports will be evaluated using blood samples. Finally, a tailor-made device for the electrospan membranes will be created using 3D printed to create prototypes, and then these will be tested in a proof of concept experiments. So why doing this project? Well, in addition to full funding for 4 years, you will be having the chance to work in a multidisciplinary team comprising of a biochemical engineer, a mechanical engineer, and also a biologist and immunologist. You will also have input from our clinical partners, the orthopedic surgeons. You will be able to learn a lot of techniques such as electrospinning, material characterization, and biological assays. You'll have the chance to work at the new regenerative medicine laboratories at the Royal Orthopaedic Hospital, and also you can do a placement with our collaborators in the Czech Republic. But most importantly, by doing this project, you're going to do some research which is going to help towards the better diagnosis and treatment of rare bone cancers. Thank you for listening.